Good day everyone, I am Queni Galagatan. I will discuss today the adolescent reproductive health education. So, in the 2013 Young Adult Fertility and Sexuality Study conducted by the Demographic Research and Development Foundation and University of the Philippines Population Institute revealed that the proportion of youth aged 15 to 24 who had early sexual encounters increased from 23% in 2002 to 32% in 2013. The 2017 National Demographic Health Survey of the Philippine Statistics Authority also reported that the proportion of adolescent girls who had begun childbearing rises rapidly with age from 1% at age 15 to 22% at age 19. The 2013 Functional Literacy, Education, and Mass Media Survey report of the PSA has identified marriage as one of the top reasons for not attending school at 12.9% in a survey done amongst young people 6 to 24 years old. This is particularly highest in the Cordillera Administrative Region, Davao Region, and Soc-Sargen. In addition, from January 1984 to February 2018, 28% of the reported cases of human immunodeficiency virus were 15 to 24 years old, according to the Department of Health. In 2016, the Department of Social Welfare and Development reported that these alarming incidents of risky sexual and social behaviors are further exacerbated by the prevalence of sexual violence among 17% of adolescents from 13 to 17 years old. So the current situation of increasing early pregnancies, violence, and increasing incidence of HIV among young Filipinos has brought more attention to the need to equip them with the correct information and appropriate life skills that would enable them to make responsible decision-making and respectful behavior that will protect their health, well-being, and dignity. So the DepEd is committed to provide and protect the rights of Filipino learners to good education and improve health, and to help Filipino learners complete basic education without the burden of health concerns. It also recognizes the rules and responsibilities of the school system to give learners the right to good health by leading the implementation of the comprehensive sexuality education. In order to effectively address the needs of the learners for health and protection through education, CSE, or the Comprehensive Sexuality Education, designed to ensure that learners are receiving comprehensive and appropriate information that can advance gender equality and empowerment. So CSE has been shown to increase learners' knowledge, clarify their values and attitudes, and develop the skills to reduce risk related to poor health outcomes and achieve their full potential. Adolescents. It described as an exciting and challenging phase in one's life. It is at this phase when children traverse adulthood and encounter various changes in their social and physical environment. At this phase, when the foundation of their childhood would play a significant role in terms of their behavior, attitudes, as well as in decisions that they will have to make every day. Many challenges that adolescents face is related to their sexuality and reproductive health. Unfortunately, more often than not, when adolescents are confronted with issues on sexuality and reproductive health, they automatically turn to their peers, who oftentimes do not know any better for answers. In the Philippines, there is a growing concern on adolescent reproductive health, especially with the rise in teenage pregnancies and HIV cases among young people. But even without this, adolescent reproductive health should be continuing concern for parents and government officials so that adolescents can continue to lead healthy lives as they go through this transition period from childhood to adulthood and keep on searching for answers along the way. It is the duty and obligation of parents and the government to give them correct information and proper guidance. PLCPD, or the Philippine Legislators Committee on Population and Development Foundation, believes that it is only through correct and age-appropriate instruction and information that parents and the government can help adolescents in their journey towards adulthood and in ensuring a better quality of life that they deserve. Toward this end, PLCPD has published Towards a Better Future for the Youth as a tool of information not only for adolescents but also for other stakeholders including parents, teachers, guardians, as well as policymakers. What is adolescence? There are different terms and age range are being used by various organizations and institutions when it comes to defining adolescence. The first one is the United Nations Convention on the Right of the Child. Defines those belonging to age group 0 to 18 years old considered as children, while the United Nations Population Fund, the World Health Organization, and the UN Children Fund consider those belonging to age group 10 to 19 years old as adolescents. At the same time, the UNFPA and the UNICEF regard those belonging to age group 10 to 14 years as very young adolescents. UNFPA, WHO, and UNICEF also consider those belonging to age group 15 to 24 as youth and 10 to 24 as young people. However, they may be categorized based on age group. Adolescence is a period when children traverse to adulthood. So it is a phase in life when physical, emotional, cognitive, and social changes occur. It is that stage where children start to build their identities, establish their relationships with others, and determine their perspective, often independent from that of the environment they grow up in. Also, the stage when children start to establish self-determination, self-reliance, and self-worth. This process involves experiencing situations where adolescents will not to take risks or try out options set before them. This process is inevitable, as this will also be the vehicle for adolescents to define what will work for their future and what will not. Very young adolescents are just beginning to form their identities, which are shaped by internal and external influences. Signs of physical maturation. Pubic and axillary hair appear. Girls develop breast buds and may begin to menstruate. In boys, the penis and testicles grow, facial hair develops, and the voice deepens. As young adolescents become aware of their sexuality, they may begin to experiment with sex. They also may experiment with substances such as alcohol and tobacco. Adolescent sexual and reproductive health programs should develop strategies that specifically target very young adolescents, tailoring interventions that are appropriate to their level of maturity, experience, and development. During middle adolescence, 15 to 16 years of age, adolescents begin to develop ideals and select role models. Peers are very important to adolescents in this age group, and they are strongly influenced by them. Sexual orientation develops progressively, and non-heterosexual individuals may begin to experience internal conflict, particularly during middle adolescence. At the other end of the spectrum are older adolescents, the 17 to 19 years of age, who may look and act like adults, but who have still not reached cognitive, behavioral, and emotional maturity. While older adolescents may make decisions independently, they may be employed, their sexual identities are solidified, and they may even marry and start families. They still benefit from the influence of adult role models as well as family and social structures to help them complete the transition into adulthood. Who are the Filipino adolescents? As of 2010, Filipino adolescents aged 10 to 19 comprised 22% or 20.2 million of the country's total population. The 2010 census also reported that at least 33.4% of the population, or 30.7 million Filipinos, are under 15 years of age. Compared with previous years, the percent share of the young population in the population is decreasing. However, with the growing population base, the number of young population or adolescents for that matter is still continuously rising. In 2000, the National Statistic Office reported that children under 15 years old accounted for 37.1% of the household population in the country. In 2008, adolescents comprised about 21% of the estimated 90 million population, or 18.9 million. On the other hand, young people aged 10 to 24 accounted for 30.5% of the population. So the proportion of young people is projected to decrease further to 27% by 2025, or a total of 32 million. What is the state of Filipino adolescents? Adolescents comprise the majority of the school-age population of the country. At 10 years old, they are expected to be at 5th grade in elementary school. Those aged 12 to 15, on the other hand, are expected to be in high school. Data from the Department of Education on participation rate revealed that for school year 2010 to 2011, at least 10% of elementary-age children 6 to 11 years old were not attending school. The data for secondary education is even more appealing, with 39% of adolescents aged 12 to 15 being out of the school. The dropouts rates for elementary and secondary education were reported at 6.29% and 7.79% respectively. The poverty and economics are among the most common reasons for adolescents' inability to attend school. The 1987 Constitution states that the state shall establish and maintain a system of free public education in the elementary and high school levels, without limiting the natural rights of parents to rear their children. Elementary education is compulsory for all children of school age. Despite that, some parents or families still find it hard to send their kids to school due to insufficient resources, which is also why a number of children and adolescents are already part of the labor force of the country. Consequently, poverty also affects the health of Filipino adolescents. In 2003 to 2004 Global School-Based Student Health Survey, there are 7.8% of students surveyed had gone hungry all of the time or most of the time in the last 30 days. The percentage of underweight adolescents had hovered at about 16% since 1993. The tobacco and alcohol intake is also prevalent among Filipino adolescents. What is adolescent reproductive health? So in Republic Act 10354 or the Reproductive Health Law defines reproductive health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and to its functions and processes. So this implies that people are able to have a responsible, safe, and consensual and satisfying sex life, that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. This further implies that women and men attain equal relationships in matters related to sexual relations and reproduction. As it pertains to all matters relating to the reproductive system, its function and processes, reproductive health therefore also concerns adolescents during their transition from childhood to adulthood. One of the major changes in adolescence is related to the reproductive system. It is, however, the duty of the parents, families, and the state to afford adolescents reproductive health information and services, if only to guide them and veer them away from misconceptions on sexuality and reproductive health, and prevent teenage pregnancies and sexually transmitted diseases and infections including HIV, among others. Fulfilling this duty will consequently help adolescents in discerning which options will guarantee them a better quality of life. What are countries' concerns on adolescents' reproductive health? Just as Filipino adolescents are engaging in risky behavior such as smoking and drinking. So they engage in risky sexual behavior, while some choose to keep a blind eye on these matters. The data state it very clear that Filipino adolescents engage in premarital sex, are exposed to pornographic materials, and for female adolescents, go through teenage pregnancy. Mistaken ideas and unsafe sex practice among adolescents also lead to incidents of sexually transmitted diseases. So comparing the 1994 and 2002 data, the 2002 Young Adult Fertility and Sexuality Study reveals that there had been an increase in premarital sex activity among male and female adolescents. So among male adolescents, premarital sex experience, it increased from 26.1% in 1994 and in 2002, 31.2%. For female adolescent premarital sex experience, it rose from 10.1% in 1994 to 15.9% in 2002. As to their sexual debut, at least 3.5% had their first sexual activity while in elementary, and 20% in high school, 13% after high school graduation, and while in college, 13%. Exposure to pornography is no doubt one of the factors that contribute to the early sexual debut of adolescents. Unfortunately, sexual exposure and activity among adolescents have led to numerous greater concern. So the data from the University of the Philippines Population Institute reveal that the country has the third highest number of teenage pregnancies compared among Southeast Asian countries based on 2000 to 2005 comparative data from the United Nations. But what is most alarming is that it is only in the Philippines that teenage pregnancy is on the increasing trend. Furthermore, the misconceptions on pregnancy are prevalent among adolescents. So, because they knew that pregnancy is possible only after a girl is physically able to menstruate, are unaware that pregnancy can occur after only one intercourse, and to know the relationship between the menstrual cycle and safe and unsafe times to have sex. How can adolescent sexual risk behavior be addressed? So an informed citizenry is an empowered citizenry. The same holds true for adolescents. Contrary to others' viewpoint, providing adolescents information on sexuality and reproductive health will not lead to increased sexual activity among adolescents. In fact, the absence of correct and age-appropriate information has led to the state of adolescent reproductive health that we have now, one that is characterized by increasing the teenage pregnancies and the incidence of HIV. However, if we provide correct and age-appropriate information, it will eliminate the curiosity among adolescents and will make them aware of the consequences of sexual activity and help veer them away from such. So the concern really is when sexuality education should start and to whom should it be given. So the correct and the age-appropriate information should be provided primarily to the poorest of the poor. and should start at the elementary level. So why is addressing ARH complementary to achieving the health MDGs? So to set the attain by 2015, there are 189 countries signed the Millennium Declaration, which defines target embodied in the Millennium Development Goals, or the MDG. So among the 8 MDGs, these are called the health MDGs, including the MDG 4, or reduce child mortality, the MDG 5, improve maternal health, and the MDG 6, combat HIV and AIDS, malaria, and other diseases. While the country has been faring well in reducing child mortality, much still has to be done in order to significantly improve maternal health and arrest the alarming rise in new HIV cases in the country. Addressing the country's concern on adolescent reproductive health can be very beneficial in the country's efforts toward achieving the health MDGs. To date, the government admits that achieving MDG 5 is very challenging. Instead of registering decrease in maternal mortality, the Department of Health reports an alarming increase. Lack of access to family planning, RH services, low or stagnant contraceptive prevalence rate, lack of antenatal and postnatal checkups, home-based deliveries and deliveries attended by traditional birth attendants, or what we call HELOT. So the MDG4 aim to improve household food security and nutrition information, increase children's chances of growing to adulthood. It assists poor households and communities to secure access to nutritionally adequate diets, reduce child undernutrition. MDG 5 aims to reduce maternal mortality by 75% and achieve universal access to reproductive health. Improving maternal health is critical to saving the lives of hundreds of thousands of women who die due to complications from pregnancy and childbirth each year. HIV and AIDS incidence among adolescents is also alarming. MDG 6 aims to combat HIV/AIDS, malaria, and other diseases. HIV, malaria, and other diseases have a direct and indirect impact on rural development, agricultural productivity, and food and nutrition security. Resolve to comprehensively address ARH concerns will contribute in achieving the MDG targets. In the same manner, if ARH concerns are left ignored and set aside, it is not only the MDG targets that we will be missing. This will also mean that we will go with the state policy of promoting and protecting the youth's physical, moral, spiritual, intellectual, and social well-being as stated in the 1987 Philippine Constitution.